All right, so for our agenda, so again, hopefully everybody's enjoying the summer, although here in Twin Cities, it's a little chilly today, but I think it's supposed to warm up later, so.
Chilly? This is not chilly. What?
That is a good point. You know, I keep thinking 70 degrees is chilly, but yeah, of course it's not chilly. Yeah, so here I am a little spoiled with the weather. Okay, so yeah, so our agenda for today is to follow up on MBQIP data submissions and accessing of MBQIP data reports on the share file system. So this was a conversation we had back in March. We kind of looked at the data to see, you know, how many hospitals are submitting measures, how many are not, what's that kind of breakdown look like. Then Robin did some really intense follow-ups with those who were not submitting data to kind of understand better what the reasons are for not submitting, if there are issues with, you know, the files, the system for data submission, kind of what those issues are and how she can help problem solve with people on those. So we have a follow-up to kind of, the follow-up is really then, we had a couple of submissions, data submissions since then. So we want to see how the data submission rate has changed since that conversation back in March. So Robin will be going over that. And then the same, we want to look at the share file system. Are people logging in now to view their MBQIP quarterly data reports? On the last call back in March, Jody went over how to access share file system and how to view the reports on the share file system, how to download them. So we also kind of went back to see if people are logging in. So we are able to tell if hospitals are logging in to see their reports. So we have some numbers that we want to share with you and see how that's changed or not. And then again, if it's, you know, if people are, we also want to understand if people are still having issues with accessing share file and what those issues are and how we can help you problem solve. We also want to follow up on the June MBQIP data abstraction training. So Robin did 3 trainings, so she'll talk more about that. She'll talk about the so after each training, there was a quiz that Robin wanted participants to complete. So she'll talk about some common issues that she saw with the quiz questions and responses. So that will kind of help further instill the work that she did during the data training about, you know, how to abstract measures and what to look for. So we also want to kind of do a refresh and overview of quality improvement tools that are on the Stratus Health website, as well as the external website where we store all of the quality improvement resources and tools. So we just wanted to do a little reminder to kind of remind you, here are all the tools, they're available, they're on the website. So just, you know, sometimes, you know, we all forget what's available and what's not. So we just wanted to do that refresh today. And then just that, you know, there is a National Mentors Program going on this year, as in the years past. There is the work that group is doing. And there's also a resource site where we have some resources from last year from these conversations that are quality improvement aimed, that you can also access and see what this group is working on and what tools they have come up with. So again, our team. So I am going to turn it over now to Robin to talk about the follow-up on MBQIP data reporting.
Hi, everybody. Want to show you that, you know, the latest data we have is from Q4 2021 for the AMI, the ED, OP22, and HCP. And then we're always that quarter ahead for EDTC. But let's talk a little bit about how we're doing on the measure reporting. Now, our EDTC, we really stay steady at 76. We have 77 critical access hospitals, but we have one that just does not submit. And and really, there's really not much we can do about that. We've got 76 that we really almost every quarter end up with 76. So we're doing a great job with that. We want to keep that steady. Hopefully everyone is understanding the value of those EDTC measures, and there just seems to not be issues about putting it in the portal, getting it done timely. So doing good as far as reporting on the measures. We're going to work on our rates for the measures, but right now for reporting, we're doing really good. For the OP22 and the which is left without being seen, and the HCP, which is healthcare personnel influenza vaccination, we really did a great job from 2020 to 2021. We really improved. On our OP22 in 2020, because these are the yearly measures, we only had 55 hospitals reporting in 2020, and we bumped that up to 73 for this past May for the 2021 data. So we only had 4 hospitals that didn't submit. Now, I will say it took a lot of work, I think. I mean, certainly on your part to get it in, but also I really contacted everybody. You got an email from me, individual email, if you didn't submit it, last year for 2020. So wanting to know what was the problem. Did you just forget? Did you, were you unsure how to do it? We really tried to work on upping those, and it did. It did a great job. Like I said, we only ended up with 4 not reporting. So if you were one of those who didn't report, why is that? Did you still not know how? Did you just forget? Did you think you reported, but it didn't show up on the MBQIP reports? Because remember, we're getting this information from those MBQIP reports. So this is what the MBQIP report showed us, that 73 submitted OP22, 4 didn't. So if you believe, look at your reports, and if it shows you didn't report, then we need to have a conversation if you think that you did, to figure out what might have went wrong. For HCP, again, we really bumped it up. We went from 53 last year to 65 reporting this year. That still leaves 12 who didn't. We would like to get that up to having 0 who didn't, but this is the one where you've got to put the data into NHSN. Was there potentially missing the due date? Did you have some issues with your infection control person? Are they the person who's entering it? Was there like a disconnect from when measures are due from what you know to what maybe they know when it had to be in? We've got another year to work on it, but again, it's a measure. We'd like to, get as close to the 77 reporting as we can. But this was another one where it was one-on-one, a connection with you guys saying, hey, you didn't report this last year. It's coming due again now. We sent out the end of April, beginning of May, we sent out the emails. So if this is what it's going to take is, individual one-on-one, then you're just going to be hearing from us this way more often, because we really want to get these numbers up. For our Q4, now I realize Q1 of 2021 was due in August, but again, we only know this once the MBQIP reports come out. We went down a little bit on our reporting of the AMI, which is OP2 and 3, and ED throughput, which is OP18. We had 68 reporting this quarter, where we had 73 reporting for Q3. So gotta ask what happened. We really pushed OP22 and HCP. So did you forget about the AMI and the ED? Was there trouble with putting it into hospital quality reporting? Do you, again, look at those MBQIP reports. Do you believe you reported, but the data's not there? I can't help you with this unless I know what the problem is. Otherwise, we just have to assume that 11 didn't even really try. yeah, would it be a 9, 60 reporting? 9, you know, what happened there. So again, contact me if you look into your reports and you believe you reported, but the data is not there. It could be a rare instance that maybe something happened with when the reports were being made. You know, I mean, that's always a possibility, but usually it's your data just never made it to the warehouse. Or for HCP, your data never made it to NHSN, or it didn't make it timely enough for the files to get to the people that make the MBQIP reports. So we're still going to be working on this. This is like a never-ending thing for us, but very, very happy with how we upped our OP22 and HCP, and in general, you know, great on our EDTC, and we're just going to keep on working on it. Anybody have any questions around those?
Just a reminder, people can also chat in too as we go. Yeah.
Okay, if you don't want to talk online, if you want to know if you're one of the hospitals that didn't report or that I have as not reporting, you can contact me outside of this, and we can chat.
Oops, sorry, I gotta skip. So the next one is the MBQIP data reports, logging in into share file to view the reports. Robin, do you want to take this one too?
Yeah, that's fine. This is what we do. We are able to look and see who has logged in. These are the months in which Jody has made reports available for you, that the MBQIP reports were available. We're about a little less than half, or about a little less than half of people have checked in. Again, I'm not going to pretend, because we all know that the data is on the older side. So maybe you use other data for, you know, quality improvement or other things in your facility. But if nothing else, you need to log in and look at these reports and make sure that data is showing if you submitted. Okay, if you know you didn't submit, well, in the data, there's not going to be anything on there. But again, if you believe you submitted, but the data shows nothing, we've got to figure out what happened. And remember, this is data that, you know, you're submitting to hospital quality reporting, you're submitting to CMS. So the data shows up on the MBQIP reports because of files that come, data that CMS says they've gotten, and they submit it to the people that make the MBQIP reports. So if there's no data on your reports, there's no data in the CMS warehouse for you on these measures. Okay, so remember, that's the issue. CMS would be showing no data. And yes, you know, submission for the CMS programs are voluntary, but if you believe you submitted, you want that data to be in their warehouse. You want the data to be on the MBQIP reports. That's how we monitor whether a hospital is participating in this MBQIP Flex program. So you should really be logging in on those reports and making sure that it's an accurate reflection of whether you've submitted data or not. Anybody have any questions? If you're unsure how to do it, send an email to Jody. Jody will show you again, let you know. And if you have questions about what they're showing, contact me and we can talk about it. Anybody have any questions on that? And I realize, you guys, we're probably talking to the people who are the ones that are looking in. You know, you guys who come on our calls, you are probably the ones that are looking in. So I'm probably preaching to the choir, but maybe, maybe we've got someone who doesn't come on our calls regularly, or maybe someone who isn't looking at this and who's on for the first time. So I apologize if you feel like you're hearing the same thing, but it's kind of our only way. This is our only method of communication with you guys. So
I'll just note that Jody dropped in the chat her email as well as yours, Robin. So if anybody has questions about their share file logins, having trouble getting in, Jody will be your person. She is a master of that. So do you want me to move on to the next slide, Robin?
yeah, unless anybody, I don't think anybody has any questions. So
all right. Oops. Oh, sorry. I'm in trouble here. Yeah.
Yep, that's fine to go to the next one. Again, we probably have the people who did listen to the trainings on our call, but we had 3 abstraction training sessions, 3-hour-long training sessions. One was for AMI, so OP2 and 3, and the ED measures, OP 18 and 22. One was on the CART tool and hospital quality reporting. And then one was on the EDTC abstraction. We did record all of the sessions, so the link in the slide is to how to find the recordings. We did something a little bit different, and anybody who's ever been on a past training. But because this was virtual and I wasn't able to be seeing your face to know that you might be saying you understood it, but maybe you really weren't understanding it. We did a quiz after each of the measures. And so we sent out the questions, asked you to return them. And then I let everybody know how they did on their quiz. If you had a wrong answer, I told you what the right answer was and the rationale for that. But what these next few slides are a couple of the questions where a lot of people did maybe make a mistake or have an issue. So I want to go over those. Maybe there's someone on our call today who didn't get a chance to take part in the trainings. And maybe some of these are the issues that they're having, or maybe they don't even know that they're having on some of these questions. So for the EDTC, these were some of the questions where I found the most people had problems, or there were answers that were wrong. And the first one was, this is the emergency department transfer communication measure. So we don't include patients who are discharged from our ED. And that answer is false. Okay, I mean, it is the emergency department transfer communication measure, but it's not just about transfers, okay? Get away from sticking on that word of transfer. It doesn't matter if you say they're transferred or they're discharged or whatever, they're returning to somewhere. Don't care about that word that's used. It's all about the facility that they go to when they leave your ED. That's what matters. And if they're going to a facility that's on our list in that specs manual, then they need to be a part of the measure. So again, doesn't matter if they're transferred to another acute care hospital or they're discharged to a nursing home or they're returning to the nursing home. The word used doesn't matter. It's the facility that they're going to. And if anybody has questions about these, you can speak up or put something in the chat. Patients who live in a nursing home and return there after an ED visit are considered discharged to home, so they're not included in the EDTC population for abstraction. That is false. Again, this is another one where people have problems because I think according to many of the hospital discharge codes or status or how they do it, when patients live in the nursing home and they're going back to the nursing home, they talk about them going home. And that's fine. I'm not saying that is not correct, but I am saying for this abstraction, for the EDTC measure, they are going to a facility that's listed in the included population. They're going to a facility that's listed in the other healthcare facilities, so they should be included in this population. How many EDTC cases should be submitted each quarter? Okay, this one had a couple of correct answers. The minimum is 45. Okay, you can certainly do more if you want. You can do all of your cases for a quarter. If for some reason you want to do 50, if you want to do 100, whatever. But the minimum would be 45 cases. And if you have less than 45, it would be all cases for the quarter. Okay, so as many as you want over 45, the minimum is 45. And if you have less than 45, you do them all. Any questions about those three Q&As? Okay, we can go to the next one. Got a couple more EDTC. This one was interesting to us because we didn't really know there was an issue till some things that we've been working on this year. But question is, the ED provider didn't sign their note before the patient left the facility, so it can't be used to determine if the ED provider note data element documentation requirements were met. The answer to this is false, because for that data element, there is no requirement about it having to be signed. Okay, if you look at the specifications manual for the EDTC, there are certain components of the provider note that need to be there. You know, what's the current problem, if there's any chronic conditions, we talk about that, but there's nothing that says this has to be signed. So if you have access to that note, and that's where we're seeing that there might be some issues now about people having access to the note depending upon their EHR and how it's set up, which is areas that, you know, unfortunately we have no control over, you know, that you've got to look at your individual hospitals, but there is no requirement for that individual measure that there has to be a signature on the note. And then the last one, our transfer form is a checkbox by the statement, ED record copied and sent with the patient. This was checked off and signed by the nurse at the time the patient left the hospital. If there was documentation that all the required data elements were in the record, we can use this to answer yes, the data elements were sent. And that is true, okay? It doesn't have to be more complicated than that. If you, by some chance, have a transfer form and can have a checkbox such as this, or you can work on having a transfer form that has a checkbox such as this, that's what we're asking for. This is all about documentation that those data elements that we're looking for, those 8 data elements, were sent with the patient. And I don't mean to be saying it can be as, I'm not trying to say that this is simple. I don't want it to mean that way, but I think maybe some people might be making this a little bit more difficult than it has to be, or think there has to be more to it than it has to be, for lack of a better word. But if you've got a form and you've got a statement such as this, and it's checked off and signed, we would take that to mean that, you know, the data elements were sent. Okay, we don't want you getting, you know, saying no for these and looking worse on this percentage than maybe you have to be.
Robin, there is a question in the chat.
Okay. Yeah, see, okay, so Lynn is saying in their setup, the provider note is not accessible to others until it's signed. Okay. You know, that's how they're set up. There isn't anything that, you know, there's not really much to say other, you know, unless in your facility, you would really have to bring this to the providers. If you're missing on this data element because you can't see this, that's an issue that maybe you can work on. This is the one where kind of everybody's situation might be a little bit different, and how it is set up in your record might determine what needs to be done, what you can do. So thanks for sharing that. It is really something that I can't help you with, that it's the measure requirements are saying this. So, something to work on, and everybody's is a little bit different. So again, thanks for sharing. Any other questions or comments about the EDTC? Okay, and remember, if you don't want to, if you want to contact me outside of this, that's fine too. Okay, for the AMI and ED throughput, okay, so that would be OP2 and 3 and OP18 and 22. If we have less than 5 cases that meet the AMI measure population requirements for a quarter, we aren't required to submit them for the MBQIP program, and that is false, okay? Even if you have 1 case that meets the requirements, you submit them, okay? There's no low threshold for not submitting. However many cases meet the requirements for that population, you would submit. A lot of people sometimes misunderstand this because I believe for the CMS outpatient program, they used to, and I think they still might say, if they have 5 or less, they don't require submission, but that's the CMS outpatient reporting program. We are talking about doing this for the MBQIP program. And we know for critical access hospitals, our numbers are often low. You do everyone that meets the population requirements. The next one is a specific issue that a lot of patients have with, could you go back, please? Okay. It's a question specifically to the AMI patients, but a lot of people get this one, have some issues with this one. So your chart documentation states that the patient was transferred to cardiology at General Hospital because our hospital doesn't provide that level of care. So how would you answer the data element transfer for acute coronary intervention? And there's 2 ways to answer that question. There was documentation the patient was transferred from this facility's emergency department to another facility specifically for acute coronary intervention, or there was documentation the patient was transferred from this facility's emergency department to another facility for reasons other than acute coronary intervention, or the specific reason for transfer wasn't able to be determined from medical record documentation. So all you know on this question was they were transferred to cardiology because our hospital doesn't provide that level of care, okay? That is not a specific reason for acute, that's not stating an acute coronary intervention, okay? So you would have to answer this with the second bullet there, okay? There's nothing in that statement that I read that said that they were being transferred for specifically for an acute coronary intervention. Doesn't say they were going for a cardiac cath, or they were going to the cath lab, or they were going for PTCA or whatever abbreviations they have for an angioplasty now or whatever. Okay, to answer with number 1, it has to say and document the specific intervention that are being planned, not just that they're going to cardiology floor. Okay, any questions about that or either of those? Want to slide to the next one, please. Where do you find the information on how to determine the sample sizes for the outpatient measures? Okay, that's not just really you can decide to do however many that you want. Where is that information? Okay, and it's found in the population and sampling section of the CMS Hospital Outpatient Quality Reporting Manual. Now, usually for your AMIs, you're doing them all because your numbers are really low, but it's that OP18, that ED throughput measure, where you might be able to sample. And in that section of the manual is where you're going to find that table that will give you the correct sample size, because it should not just be however many you want to do. Okay, and as always, if you want to do more than the minimum sample size, great, no problem, but you should not be doing less. All right, so that information is in the population sampling section of the CMS Outpatient Reporting Manual. If you don't know how to find those, let me know. Okay, and then this is our issue. That next question is kind of the same one that we sometimes have with the EDTC. If a patient is going to the nursing home after leaving the hospital, what should the discharge code for abstraction be? It should be 5, other healthcare facility. And now again, that might not match with your discharge code for the hospital for billing. And that's the way it is, because for abstraction, there are specific codes for the different, the specific discharge codes, and they might not match up with the billing discharge codes. But if that patient is going to a nursing home falls under other healthcare facility. So when you're abstracting, the discharge code should be 5, other healthcare facility. Any questions? Okay, and our last quiz was about CART and a little bit about the hospital quality reporting. I'm not missing anything in the chat, I don't think. Jody, am I, or Senka?
No.
Okay, so you should always have the most current version of CART installed before entering data, even if it's a different version than the time frame of the encounters you are abstracting. And the answer there is true. Okay, you always, before you're going to start entering data into CART for the quarter, make sure you've got the most current version. Even if that time frame says something different on the page where you're pulling up CART, it's always compatible with prior versions. And once you get into CART, under those provider preferences, that's when you're finding the different time frames under the drop-down list. And you make sure that you set your preferences for the time frame. How can you determine which version of CART you have installed on your computer? Okay, there's 2 different methods. Because one of them really isn't asking me, because I would have to ask you to look in those 2 spots that are highlighted there in the first place. Okay, I could tell you that, but so you know on your own. Okay, at the login box, you click on About Quality Management System, and it will let you know what version of CART you have. If you've already logged in under Help, you click on About Quality Management System, and it will pull up the version that you have. So in case you don't know, there's 2 ways to do it. And if you ask me, I'll always try to help you, but I don't know. Okay, just a little reminder, CART is your system. It's on your computer. Even if you have it set up as a network in your facility, the only people that have access are the people on your network. Okay, I don't see anything. MBQIP staff doesn't see anything. FORHP doesn't see anything. CMS doesn't see anything until you submit data to hospital quality reporting. So CART is yours and yours alone. So nobody can really, everything that we ask you about CART, you've got to be the one to tell us, because we don't see any of that. Any questions about those 2? Okay, just a couple more. Senka, if you could flip the slide. To submit data to hospital quality reporting, so HQR, hospital quality reporting, you must have a HARP account. That's true, okay? The HARP account is the access, the way you can get in to what CMS now calls hospital quality reporting. That's their reporting site. So the HARP is the login to get to hospital quality reporting, which is where you would submit your population and sampling, where you would submit your web-based OP 18 or 22 measure, where you would submit your chart abstracted measure. Everything comes after you log into that HARP account. And then what is the best report to run? That will show me if the cases I submitted to hospital quality reporting were accepted or rejected. And that's the case status summary, okay? Yes, you can run a provider participation report. And yes, you can run a submission detail report, but they're gonna have a lot more stuff on there, okay? The provider participation report, that's the one that a lot of PPS hospitals will always run. So there's way more stuff on there because that's the have-tos that they have to submit. That's, you know, the mandatory for them. And I think it can just be confusing, but maybe if it's not for you, great. But if you only want to know, I submitted 25 cases, did they get there? And 25 were accepted and 0 rejected, and that's it. That's your case status summary report. Okay. And if you don't know how to run that, let me know. And so you should be running that every time you submit data, after you submit data, because that's going to tell you, you know, before the due date, maybe what didn't get there. It's going to tell, you know, because once the due date comes, that's it. You can't submit. The warehouses are closed. So that means no data to CMS, no data on your MBQIP reports. And I can't tell you this, okay? I have no access to this. So, you know, I can't tell you 2 days before the due date, hey, you've got no data in the warehouse. I don't see it. I wish I did, because I think that would maybe help us. You know, it would maybe get the people who don't run this report and think they submitted data, but I don't have access. CMS doesn't give it to us. This is just a hospital can run this report on their own. Okay. Any questions about those or any of the, you know, these were some of the data elements that I really felt like I wanted to emphasize. I emphasized on the training, or that some people kind of missed. So if you didn't get a chance to listen to the training, again, that first slide had the links. And if you're somehow going back and doing it and want to take a quiz after, let myself or Jody know and we can send you the quiz. Okay, I didn't just want to put the quizzes out there because with the answers, because if people got answers wrong, I wanted to give an explanation of why they got them wrong, or have them contact me. But you know, if you're listening to any of those trainings and would like the quiz, just let me know. One last time for any questions.
Just a reminder, everybody, you can chat it in or you can unmute yourself and just ask. So whatever works.
You know, and these are going to be, well, Q1 was just due, but these are going to be the measures for the rest of this year, you know, for the Q2, Q3, Q4. So, you know, there's no information, no plan for these to be going away this year. So these are the continued measures for, you know, the next 3 reporting quarters.
Okay.
Well, thanks everybody for listening.
All right, so now we'll move into some of the quality improvement resources and tools that are on the Stratus Health website or the Flex program website. So we will pull up, so just a reminder, back in February, March of this year, again, we did a survey asking, you know, how hospitals are using the MBQIP reports for the QI efforts. The 29 hospitals responded to that question. 22 said yes, they were using the MBQIP reports to help inform their QI efforts, and then 7 said no. And then each of those yes and no's listed as to how they are using the QI reports for which purposes, for those that responded yes, and then those who said no, that they were not using them, they listed the reasons as far as to why they were not using them. So again, you can see from yeses, it's benchmarking, setting goals, ideas for quality improvement, star ratings, and just kind of wanting to look at some specific reports that the hospitals were interested in. For no's, there's the fatigue with so many quality reports. Some have real-time data that they are able to look at, so don't need to look at the MBQIP reports. And then also understand between facilities, what's happening between facilities. And then also others are looking at other data, not necessarily at the core MBQIP data reports. So the next one is, again, from the survey, asking about the core MBQIP measures, quality improvements, activities that the hospitals were thinking about focusing on in the near future, or are currently working on. And EDTC came out on the top, followed by OP18 and antibiotic stewardship, and then AMI OP2 measure. And the others as well were quite significant too. HCP, OP22, and OP3, we still had significant percentages of hospitals saying that they were looking at those. And then there was an 18% saying that they were not looking at any of these. Okay, so I think I had a slide that skipped, just a sec. Okay, so so again, before we get into the quality improvement resources, where they are on the website, we talked about this at our May call, kind of a reminder about the National Mentors Program update for the 2021. We do have 3 mentors from Minnesota serving on this group. So this year's mentors are from Minnesota are Karen Bombersback from Caris Health Redwood Hospital, and then Marilyn Deno from Community Memorial Hospital in Cloquet, Tammy Suchi from Tri-County Hospital in Medina. So they are our mentors for this year. And then, so they don't have their resources posted yet on the Stratus website, but we still have the resources from last year mentors program. So I'm gonna click on that link and kind of show you what's on the resources from the work of the mentors group from last year. So I'm gonna do open. So again, just a reminder, we will be sending this slide deck out to everyone who is on the call today, and then we will also post it on our website. So these links are all hyperlinked in the slide deck, so you'll be able to click on them and to get to the resources that you want to get, that you are looking to get to. So I'm just going to stop share here for a moment because I'm having a little bit of a trouble here opening up the document. So just a sec. So I'm going to share again here. So I'm going to do now. So yeah, if I do the open link. So now the resource open up. Are people able to see it? Robin, can you see it?
No, I think you have to stop sharing and share again, Senka.
Share again. Okay, so I will do this. Okay, so this is what the page is. So here are some resources that they have. They had some, so last year, this is the cohort from last year. Again, they call these quality improvement, mentor performance improvement experience. So they have conversations about different topics in QI. So there was one about patient and family engagement. So how to get that going, some improvement ideas. So I'm gonna click on this little chart that they have. Okay, that's not gonna work. So this is, oops, so I'm unable to click on it, but there are some ideas here. Session, and then making quality improvement funds, ideas on that, creative ways to draw in staff to work on quality improvement initiatives, how to use small data to drive big improvements. So this is, if you're not a big hospital, you only have few patients, how can you still understand what's happening with those few patients to help drive forward the improvements that you are looking to make? How to engage board and leadership to help drive quality of improvement and outcomes, involving board and leadership, engaging the whole team, and then also some research on the impact of the COVID-19 on quality improvement. So those are some resources from the past, from the group from last year. We are expecting this year's resources to be posted soon, so we'll get that updated soon. So I'm going to go back to the slide deck again, stop share here, and then share the slide deck. So the other resources are more of the, so the tools. So the Flex website, the quality improvement implementation guide and toolkit from Critical Access Hospitals. So this is again a toolkit to help critical access hospitals think about the quality improvement, what tool, bring forward some tools, and just as you embark on projects, there are some tools here that can be used to help with that. So again, just to highlight the quality improvement measures summary. So this is
Bianca, just we're not seeing the link. If you're going there, we don't see it.
This is always an issue with Zoom. If you're sharing one document and you try sharing another one, it doesn't always switch over automatically. So are you able to see it now?
Yes. Okay. Yes.
Perfect. So again, reminders about some QI tools. Again, as you embark on starting a new project, these tools can be used to help kind of organize and then guide you through the next steps in the project. So I would really recommend going to this page and kind of reading up a little bit about these tools, and kind of, there's some tools that can be used for different purposes. So they're all listed and hyperlinked here. But again, it's that guidance, how you start the project, how do you do it, how do you monitor, how do you track outcomes. So that's part of all of this toolkit. And again, all of you are experts. I should have prefaced this. All of you are QI experts, and this is, all in your toolbox. But it's kind of a good refresher to kind of know, if you're looking for something and you really want to look at something else, a tool, rather than starting and developing your own, these tools have already been built. So you might as well use the ones that are already available. And again, you don't have to use it exactly the way it's done here. You can take it as the baseline and then adapt it to your needs. But again, most of you probably have a lot of these built already. So then I'm going to go back to the slides. So I apologize for the back and forth with the slides. I still have not figured out how to exactly get them all pulled up at the same time. So again, sometimes we all need a refresher about the QI basics. So again, Stratus Health, has the course on just the quality improvement basics, the facilitator's guide. Again, this is also as you get new people onboarded with your organization, they are new to the role and you really want a quick and dirty on QI for them. This would be a really good resource for them to use, to check out. Again, rather than having to build your own training, your own course on this, you can just direct them to Stratus Health website and that information is there versus having you to do it all, to build all of those tools. And then I'm going to share the deck again. And then, there's also a link to other organizations with QI tools. again, this is good for people starting out in the QI. Again, if you have new staff that's coming on board, this is another resource. Sorry, I'm just going to figure out how to, I'm going to open up the link here. Just a sec, I'm going to open up another document. It's like multiple documents to get to what I need. Okay, so this is another resource, from other organizations on what they offer as far as the QI tool. Again, new people getting onboarded, fresh to new QI, these would be really good resources for them to check out. And again, how to use run and control charts. Again, that's a really good blast from the past as I look at this. Models for improvements, IHI, some open school basics and trainings, HRQ, information on measures and toolkits, team steps, facilitation handbook, measurement sites for measures, kind of like MIPS program. What are the required measures for MIPS, for APMs, required measures, and other CMS programs for the measures that are required. So a lot of these would not apply to you since you're critical access hospitals, but some of the resources on the first page and on the top of the second page might be helpful. So just a kind of refresher, a reminder for all of us really to kind of, it's always kind of easy to forget about all of the resources and then try to develop our own. And it's good to know that some of these resources have already been developed and are available. So whenever you need something, you can just go to our website or the websites that are on the other websites on the page and just click on those and get the resources pulled from there. So again, we will be sending this PowerPoint as a follow-up in our follow-up email. So all of those will be, thank you, Jody. Yes. So all of those will be, the links are all built in on the deck. So you'll be able to click on them and get to those resources. So, well, that's it about the QI resources. I'm going to stop sharing now. We do have a little bit of more time left. So I just want to open it up again and see if there are any burning issues, burning questions related to what we talked about today or unrelated to what we talked about today that anybody wants to ask, bring up. So I'm not seeing any chats or I'm not hearing any questions. So I think, we can wrap it up at this time. So again, thank you all so much for your time today. Really grateful that you were able to log in and participate with us on this call. Again, any questions, anything, data reporting, share file, abstraction, QI, resources and tools, feel free to reach out to any one of us at any time. So again, really, really appreciate your time today. And I hope, we all hope on behalf of the team here hope you all enjoy the rest of the summer and we will see you again soon.